We have with us Miss Rita Dano. Miss Rita Dano, you are the head of the 12 Steps DAC at the Ankaful Psychiatric Hospital. So please tell us, what is the 12 Steps DAC or the 12 Steps DARC, and what do you do here?
So the 12 Steps DAC, as we do call it in Ankaful, is a drug and alcohol rehab center. Specifically within the Ankaful facility. The name is 12 Steps because we employ the 12 Steps principles in helping our clients break through the bonds of addiction.
Oh, okay. Yeah. All right. You are talking about helping clients break through the bonds of addiction. So what kind of patients do you really care for?
We care for people living with the disease of addiction. That is what I would say. Even though it's mainly for drug addicts, let me say that even now we don't use the name drug addicts, people living with the disease of addiction. We've treated clients who were having issues with the PC. We've had one case of that before. And I think we've also had one case with sexual issues, addicted sexually before. But specifically, we care for clients with drugs and alcohol problems.
Oh, okay. Yeah. So if someone has had an issue with alcohol addiction, the person can come here or any kind of substance. What if the person doesn't have the willingness? Can the person still be treated, or can the person go through your process here?
Yeah, so the first requirement is the person must be willing. First, the person must admit that they have a problem and that they are willing to stop. Then we can also offer the help. But looking at the 12 Steps model, using that model with a narcotic drug and anonymous group, sometimes the person might not be willing, but we have a term that says that act as if. So even though you are not willing, you act as if you are in it. So with time, as we go through the therapies, enhancing the client's motivation, they intend to accept the treatment that we offer. One thing is, if you are waiting for our client to say, I'm willing to stop, then we won't get anyone.
Yeah, definitely.
Yeah, you won't get anyone. But once he shows some level of motivation, then we take it up from there.
Oh, okay. Mm-hmm. What if there is no motivation? Is there a way that you can encourage the person to?
Once we try our best and the motivation is not forthcoming, then it would be advisable to refer the client to possibly go through OPD-based counseling. To the point that the clients will accept the treatment.
Okay. There is a general perception of what substance abuse is. Please tell us, what is the expert view of substance abuse?
Abuse, as in as the word abuse, using someone as something that has not been prescribed medically to the layman's view. That is what I would say. When it comes to the substance abuse, we have a whole lot of substances that people do abuse. Even those that sometimes when you open up to people, they wonder, is this also part of it? You see, anything that you take in that alters the normal functions of the body, in fact, it's known as a substance. So when you come to Ghana and this rehabs, to be specific, most of the key cases that we do see the cannabis, which we all know, the cocaine, the heroin, the alcohol, and other things. But usually when we probe further, you realize that people are also abuses this the nail strippers.
Wow.
Mm-hmm. Even some of the paint.
Really?
Yes. Then this thing that they use to wash away the paint, the tapping time. Okay. People do abuse it.
Wow.
Yeah. But the major ones that so far we have seen it within this facility has been the cannabis.
Okay.
Mm-hmm. Yeah, cannabis stops it. Yeah. Then alcohol follows. Then we'll get the prescription drugs like Petadine and those other substances.
Okay.
Yeah.
Let me ask this. So when we talk about, you're talking about taking in drugs that have not been prescribed.
Yeah.
We know that these are hard drugs like cannabis and others. What about going to the drugstore to buy any ordinary drug, let's say a painkiller or some other ones without prescription?
That one too can be abused. Like the PMO, for instance, most clients who abuse these hard drugs do abuse PMO. They claim they do have some kind of aphrodisiac effect when they take in PIM, at least 10 of the tablets at a go. Yeah, so even though over-the-counter drugs, they do abuse it, because one, you go to the dispenser, you want this, they wouldn't even ask what you are using it for. They don't take any history. Today I'm feeling pain, you go there. Yes, tomorrow another pain, you go in there without any kind of prescription. You don't even know the length of duration you are going to take it for. Yeah. So they all fall under the abuse.
Wow. So how does substance abuse really affect a person's mental health?
You see, when you take in the substance, it alters the brain functions. When you talk about the depressants, like the diazepam and the alcohol and other things, it alters the normal functions of the brain. So psychologically, it does affect it. We have a chemical like dopamine and other things. It alters them. It either increases the production of it or reduces it. So it does affect the brain activity. And the long-term use of the substance should do affect them. One, the guilt of using the drugs alone is another problem. So you use this substance for some time, you want to stop, you are not able to stop. The guilt feeling, the stigma you receive from the society from abusing drugs, all do affect them mentally. And so we have a whole lot. It affects them in a wide range of categories if you want to really talk about how it affects them, their mental health. Yes.
Okay. You see, there are times that some people feel that, well, I use hard drugs, I don't have any effect. Is it really true that someone can be using cannabis and will not have any effect at all?
So one thing I've known is the effect starts with the first drug.
Okay.
You wouldn't need to take it for let me say a week or two before once you take it in today, the effect starts with the first substance. So if it is one stick of cigarette, remember that one stick of cigarette, you are having the effect there and then.
Wow.
Yeah. Wow. So as you continue to take it, then it means that you are increasing the effect of the substances.
That means if I decide to use hard drugs, any hard drug, I'll definitely have some
you
effect.
You will, once it's going into the body.
Whether it comes out openly or not, I'm having some effect.
Yeah, you are having some effect.
That's really an eye-opener. Now, sometimes when I sit down, I wonder why people even abuse drugs. So you have been in this field for some time. So with your experience in this field, what are some of the reasons why people even abuse substances in the first place?
Yeah, so based on my experiences in here, with the history so far from the clients, when you take those schooling, usually they will say out of peer influence, the pressure from their peers. And sometimes too, people voluntarily want to experiment with the drug. They've heard of the cannabis. Even last week, we had one case, one student who was saying that for him, he heard about cannabis. He heard that when he's taking cannabis, it's going to make you sharp, smart in your studies. It's going to help you to concentrate. But now he's in the facility. Wow. Why? So these are they have some kind of myths. People have just bought into certain ideas, especially the young ones, and they are experimenting with the substances. So sometimes when they come in here and we do educate them, then they act as if, hey, is that how it was? So they were all some kind of myth. So, and we have others too who blame challenges, the stress, the stresses they go through. Sometimes due to the stress, they will want an escape from their present situation, and they will go into taking the alcohol or any other drugs just to escape that reality for a period. But then, once you take, the desire to take in another time increases.
Yeah. I heard that some people also take it so that it gives them the strength to work.
Yeah.
Does it really work? I mean, will someone smoke weed or taking cannabis and then get strength to work?
That is what they do say. That is what they say. You can just imagine someone wanting to take in alcohol to get extra energy. Alcohol is going to depress your activity. So how come you want to take in alcohol to get extra energy to do something? So you see, we don't read. we just hear the people saying it, and we also want to experiment to see whether that is it. By the end of the day, you cause more harm than good.
I've been thinking about this other thing. You see, our body has its own way of functioning, and we introduce something inside, and then it can affect us mentally, like cocaine and alcohol and other things. It is something we introduce into our body. What about food? If some of these things are affecting us, can someone react to certain types of food in such a way that it's going to affect the person's mental health?
Well, when you come here, looking at the 12 steps model, they talk about overeaters, so, anonymous, and some people are addicted to certain kinds of food, like the sugary foods, like the chocolates and other things. I think it may not be common in Ghana, but when you go out there, it's common. So once that habit is interfering with your normal daily activities, your relationship with others, then it becomes a problem. That is when we can say that mentally it's affecting that person. But our normal foods, food, when you look at the chemical breakdowns, when you want to go deep, has some effect on the brain, but not to the extent that is going to affect your mental health. But when you are addicted to one particular food, then it's going to affect your relationship with others, your job, and other things. And this one, in the long term, is going to affect your mental health, your normal functions.
Okay, that's fine. So if someone has a problem with drug abuse, is there help for the person?
Yeah, there is.
So what help is there for someone?
Yeah, there is. Just like our center in here, the rehab. One thing is, I really don't know the statistics, but in Ghana, the idea of rehab is not well known. Yes, it's only few. And sometimes when the clients that we do receive in here, usually we're coming to take care of their mental health, their psychological issues, then they got to know that there is a center in here that can help them. So treatment is possible. It's possible for someone who is addicted to substances to recover. That is the rehab. Yeah.
Oh, okay.
So there is help for them once the person is willing to accept this help.
Oh, okay. Yeah. So I mean, we've heard several times when people say that, this one I'm addicted. It's not going to be easy. I mean, I can't break free from it. But you're helping us see that there is help. I mean, someone can be addicted and then break free.
Yeah.
All right. I'm sure that there are lots of people who have been addicted to drugs and then are no longer. We are indeed grateful to you. You've taught us so many things about substance abuse. We've seen how damaging it can be. We've seen that there is help for someone who is addicted to substance abuse. We are very grateful to you, Ms. Rita Dano. We've learned a lot. And then we hope that some other time we'll visit you and then you even teach us more.
Yeah, thank you very much.
Thanks a lot. We'll see you some other time.
Okay, thank you.